This one's for the mamas out there who are getting adjusted during pregnancy but have no idea why they should be getting adjusted postpartum. Well, I'll give you a quick sneak peek. For starters, you basically just ran a marathon. Do you think marathon runners train really hard, run the race, and then quit from there? No way. They have a massive and detailed recovery plan, and you should too. You spent months preparing and training for your baby's birth, creating the perfect registry, reading all the books, maybe even creating a birth plan and goals, but right when your beautiful baby has arrived, you might be feeling surprisingly overwhelmed, physically depleted, and wondering why no one warned you about how challenging the postpartum period would actually be. While most resources focus on labor and delivery, the reality is that the fourth trimester lasts far longer and receives just a fraction of the attention and support. This video is for new mothers who are struggling with physical recovery, sleep difficulties, breastfeeding challenges, or emotional regulation during the postpartum period, and who are seeking natural, drug-free solutions that support both their recovery and their baby's development. I'll be sharing why postpartum chiropractic care is crucial for both mothers and baby's nervous system health. You'll learn how birth-related stress creates subluxation and dysautonomia, how these neurological imbalances contribute to common postpartum challenges, and how gentle, specific adjustments can restore proper nervous system function, creating a foundation for optimal healing, bonding, and thriving during this critical transition time. Let's start with the stats. It's estimated that approximately 10 to 20% of mothers experience postpartum depression, highlighting its significance as a public health concern. Yet, this statistic only represents the most severe end of the spectrum. The reality is that most new mothers feel unprepared for the physical and emotional challenges that follow childbirth, with studies showing that 70 to 80% experience some form of the baby blues. What's even more concerning is the physical toll of birth that often goes unaddressed. Research has documented that during delivery, a baby experiences significant compression and twisting forces as they navigate the birth canal, with pressures reaching from 120 to over 500 millimeters of mercury on a newborn's head and neck, an extraordinary amount of force on such delicate structures. These same forces create physical strain on mom's body too. Without proper neurological support, both mother and baby can struggle to recover from these physical demands. So let's talk about what really happens to your nervous system during birth. Birth is truly a marathon, both physically and neurologically, for mother and baby alike. For mothers, labor and delivery demand extraordinary physical exertion, with your body producing complex hormones while experiencing intense pressure, stretching, and sometimes tearing of tissues. These physical and emotional stressors can create what we call subluxation, areas where the communication between your brain and body becomes compromised. For mothers, subluxation commonly occurs in the pelvis, the lumbar spine, upper cervical spine, and thoracic areas, affecting everything from core recovery to hormone regulation. Within 24 hours of birth, your estrogen and progesterone levels, hormones that were elevated during pregnancy, plummet dramatically. This abrupt hormonal transformation is often described as falling off a cliff and profoundly impacts your nervous system. These hormones don't just affect reproductive functions. They directly influence neurotransmitters in your brain and the balance of your autonomic nervous system. When your nervous system becomes dysregulated during this hormonal flux, it can lead to difficulty sleeping, anxiety, temperature regulation issues, digestive disruptions, and heightened sensitivity. The connection between you and your baby goes far beyond the emotional bond. It's a profound neurological relationship called co-regulation. Your baby's immature nervous system relies heavily on your more developed system for stability and organization. Studies indicate that babies depend on close physical contact with their mothers to regulate their heart rate, breathing patterns, body temperature, and stress hormones. When your nervous system is regulated and balanced, your baby tends to settle more easily, feed more effectively, and develop more securely. Conversely, when you experience nervous system dysregulation, your baby often exhibits signs of distress, creating a challenging cycle. So let's talk about how other common postpartum challenges connect to your nervous system. Breastfeeding difficulties often involve nervous system function, particularly the letdown reflex, which depends on optimal vagus nerve activation. Sleep problems, a nearly universal postpartum challenge, are deeply connected to the autonomic nervous system balance too. A nervous system stuck in sympathetic dominance, or your fight or flight mode, makes it difficult to relax into deep, restorative sleep, even when you're exhausted. Postpartum mood challenges represent perhaps the most significant intersection of neurological, hormonal, and psychological factors. Physical recovery complications like persistent pelvic pain, incontinence, and diastasis recti often have neurological components that extend beyond simple tissue healing. Our approach begins with comprehensive insight scans that provide objective measurements of your autonomic nervous system function. These scans serve as a window into your nervous system, allowing us to pinpoint exactly where and how subluxation is affecting your neurological function. Gentle, specific adjustments help restore proper pelvic function, reduce neurotension in your upper cervical spine, enhance nervous system communication for hormone balance, improve sleep quality, support proper muscle engagement, and promote optimal breast tissue drainage. For your baby, gentle pediatric adjustments use pressure comparable to testing the ripeness of a tomato, light and precise, to release birth-related tension and support optimal development. Click the link in our bio to learn more about us at Trinity Life Center and how to schedule your postpartum neurological assessment.